Hi, I'm Amanda.
And I'm John.
And we are 7th year medical students and your campus tour guides today. You guys aren't here in person for us to give you this tour, so we figured we'd do the next best thing.
So now it's just us two, the camera, and the magic of video production.
So we'll start off our tour right outside the School of Medicine admissions office, which you should all be very familiar with. And we know that you have already received a tour of HSEB when you came here to interview. And just to give a quick recap, we have our lecture halls here, our study rooms, the med student lounge, the game lounge, the clinical skills lab, the histology lab.
And don't forget the library.
And so now let's move on to stuff we didn't show you. So here we are in the College of Nursing, where they have a simulation lab where you do your interprofessional training and practice on mannequins.
So this is the School of Medicine building. They're supposed to tear down this building sometime soon, but they've been saying that since I got here. This is where the Student Affairs office is, and this is also the gateway to the University Hospital. So now we're outside the anatomy lab. It's about a 20-minute walk from HSCB. This is where you're going to be spending your first semester dissecting cadavers, learning all the bones, all the muscles, all the nerves, and all the things.
Here we are at the Huntsman Cancer Institute in the south side where a lot of the research labs are located. On the north side of Huntsman Cancer Institute is the Huntsman Cancer Hospital, and there is a women's cancer wing that's currently being built. And across the way here, we have the brand new rehab hospital that's going to be open in May.
So here we have the Moran Eye Center, where leading ophthalmology care and research gets done. Right across the way we have the Primary Children's Pediatric Hospital, one of the leading pediatric hospitals in the Intermountain West. And then right across the street we have the Primary Children's Outpatient Clinics, which is conveniently located right next to a UTA track stop.
So now that we've shown you the Health Sciences campus, now we want to show you some of the community and free clinics off campus that first and second year medical students can volunteer at to develop their clinical skills. Okay, so we are now in downtown Salt Lake City, right outside the 4th Street Clinic, which provides free healthcare for our homeless population. And so medical students, including first years, can volunteer at any of the specialty clinics.
So now we're at the Redwood Health Clinic, and here 2 Saturdays a month we have the PrEP Clinic, which stands for Pre-Exposure Prophylaxis. So this is really helpful for people that are high risk of contracting or being infected with HIV. This is a clinic that med students, even first years, can volunteer at.
So we're at the Malahi Free Clinic. This is a clinic for low-income and uninsured families in Utah. And so medical students have an opportunity to volunteer here, including first-year medical students, where you work in teams with other health profession students.
We're at the Midvale Community Clinic, and here's a place that you can get involved with patient care even as a first year, working with adult patients. And we're also going to show you some of the cool things that students are doing outside of campus now that they've been taken out of clinic during this pandemic.
I'm Weston Smith, third year here at the University of Utah.
My name is Elaine. I'm a third year, soon to be fourth year student here at the U.
My name is Claire Bensard. I'm a 7th year MD PhD student.
My name is Bianca Rich. I am a rising 4th year.
One of the things that's been really neat being here at the U has been the relationship with my classmates, really. Their desire to help and that everyone wants to come together. There's been so many things being done by our classmates.
I was seeing a lot of news stories from other cities showing long lines for the food bank, and I kind of wondered what was happening here since I know a lot of people who have been laid off during this time. So I went to the food bank website and I found out that over the past month they have been handing out twice the number of donations that they normally do, and that there was a big need for more donations. And I thought that our community here at the U is always so good at working together and giving back. So I thought I'd reach out and see what we could do.
She has gotten posters and collected boxes and put them around at all these different houses so that we can be collection sites for the Utah Food Bank. I am the designated sugar house home. This box is here.
We've collected, I think, around 500 pounds of food so far. So the food bank said that the blue bin itself, when it was full, would be 250 pounds, and I'm guessing that we have about that much back here as well. So, but I think we've done a really good job so far.
We're here collecting donations from the community of personal protective equipment that's in short supply in the hospitals during this COVID-19 pandemic.
We thought about different ways that we could help, and we knew that there were PPE shortages around the country and that would possibly affect our system here in Utah. So a group of medical students, including myself, got to work and organized a month's worth of donation drives that was completely staffed by medical student volunteers.
There's been so many students helping out with this. They heard about the fact that hospitals didn't have supplies, and they've wanted to help. They've been contacting news agencies, radio stations. They're just their friends and neighbors.
We've had terrific buy-in from the community, including the Salt Lake City Mayor's Office, the Salt Lake County Mayor's Office, the Salt Lake City School District, the library system, as well as support from Real Salt Lake Foundation and Rio Tinto Stadium.
People have just been coming and dropping off a lot of things. It's been really neat to see and be a part of, really.
Thanks for making it to the end of the tour.
We hope to see you in the fall. Bye.
Bye.